Hi, my name is John Mills. I'm a Presbyterian missionary here in Ocosingo, Chiapas, Mexico. I'm working with the Celtal Synod. The Celtal are a people group, descendants of the ancient Mayan Indians. There are about 1 million Celtal in Chiapas. Here in Ocosingo, we have a community of about 30,000 people. And surrounding this area in the mountains, there's a couple of 100,000 Celtal people who don't really have access to health care. And so we're standing in front of Las Manos de Cristo, the Hands of Christ medical clinic, which we are building in partnership with the Maya Synod and Hebron USA, which is a North Carolina-based nonprofit organization. And we're building this clinic because the native people here are facing much prejudice in the Spanish healthcare system, because you may think that most people speak Spanish in Mexico, but there are over 300 indigenous tribes in Mexico, and many of those people do not speak Spanish. They speak their native language, and here in this area that is Celtal. And if a Celtal person comes into go to a hospital or a clinic here in Ocosingo and they don't know how to speak Spanish, then they don't receive any services, because unlike in the United States, there is no requirement that the government provide translators for the healthcare providers. And so this is a medical clinic that's been a dream of the Celtal Synod since the early 90s, because they just knew so many people that were getting either no healthcare treatment or very poor healthcare treatment. We were up in a village back in January with Pastor Pablo Feliciano Cruz and myself and a couple of others, and a young family, a man 18 and his 17-year-old wife brought a 6-month-old baby to the pastors for prayer because he had whooping cough. And unfortunately, we were not able to do anything for that child except pray for her, and in 2 weeks she was dead. All because the family was afraid to take that child into the Spanish clinics for vaccination. So that family has hope now for the rest of their children because of Las Manos de Cristo. Inside the patient waiting area of the clinic, folks will come in and register in the registration area. You see the materials here. We're going up with the walls for the dividers for the clinic. In this area over here, we will have medical consultation rooms where our staff physicians will be able to see the patients that come in. In this front area, there will be a fully functioning pharmacy, so the patients can not only see a doctor, but they can get medication. Behind that will be an operational laboratory for testing of blood and other body fluids. On this side of the clinic, we'll have 2 operating dental chairs, so that we'll have an ability to provide dental care for the patients here. Our administration offices will be on this side of the clinic. And I mean, it takes a little bit of vision to see this, but our walls are going up. We're about 80% complete with our project. But this is only phase 1 of 3 phases of this project. This is the outpatient medical clinic. Beside it will be a surgery wing where folks can come and get a cleft palate repaired, or cataracts removed, or club foot repaired, with teams of American doctors that come down to visit for a week or 3 weeks. And below that will be dormitory space for the visiting physicians. Above us here will be, on the 2nd floor, will be office space and training facilities for the barefoot doctors. These are the local healthcare providers that the church is training here, and many times they are the only healthcare providers in their community. So this is a project that will continue for 3 to 4 years in its construction, but we hope that this facility will be seeing patients by January of 2009. So this is a project that you can become involved with, And we invite you to do that by visiting us at hebronusa.org. Las Manos de Cristo, the Hands of Christ Medical Clinic, is a project that we've been working on for over 2 years. We've raised over $200,000 to build this structure, but we're going to have to operate the clinic, and we anticipate an operating budget of $80,000 to $100,000 per year. Some of those funds will come from patients here, but there's continuing need for assistance, financial assistance, for the operation of the medical clinic. And you can visit hebronusa.org for more information about how to make contributions to the medical clinic, either for the construction of Phase 2 or for the operation of Las Manos de Cristo. Thank you very much.